for this war isn't going to the troops. A small fraction goes to the troops. So we need to have a strong military. We need to encourage people to be serving in our country's military. But we've got to end the United States' commitment to war as an instrument of diplomacy.
All right, I'm going to bring everybody in, but Senator Obama, you want to increase the size of the U.S. military by almost 100,000 troops. That's going to cost billions and billions of dollars. What do you say to Congressman Kucinich, who says he wants to cut the size of the U.S. military?
Well, keep in mind that there's a difference between the Pentagon budget and the size of the military. So it may be that, for example, there are weapon systems that Dennis and I would agree are outmoded relics of the Cold War. But what I want to make certain of is that our troops are not going on these repeated tours, lengthy tours, that we are providing them with all the support they need when they're on the ground, and we can't do that currently. We also need, and I want to make sure that this is emphasized, that when they come home, we are treating them with the dignity and honor that they deserve. And that's something, whether you were for the war or against the war, we can all agree to. And this administration has not done that because they tried to do it on the cheap. Folks who have post-traumatic stress disorder, folks who have disability payments that are due are not getting the kinds of services they deserve. I have some specific plans to address that.
Senator Dodd, are there relics of the Cold War, big-ticket military items that you would cut?
Well, first of all, thank you for your service as well. And by the way, whatever other disagreements there are about policy, all of us here on this dais applaud immensely the work being done by our men and women in uniform. I think a round of applause for what you're doing here. We appreciate it immensely. Thank you. And that's the right issue, I think. We're not listening to our senior military people, by the way, who tried to engage in the transformation of our military needs here, recognizing that there's different threats we face today than we did during the Cold War. And clearly, there needs to be a reassessment of what those priorities are, what those systems are, so that we're strong enough. We all need to say this, by the way. I think it's very, very important. No one's going to be elected president, or ought to be president, that's not going to have as their primary priority keeping us safe and secure. That is the principal responsibility of an American president. But to do that, you've also got to make sure that we're going to be prepared to use that force, not as the first arrow we draw out of the quiver, but rather utilizing the other resources we have as a nation to advance our interests. That has not happened here under this administration. We need to get back to that as a nation.
But is there a specific military
program? Absolutely. Clearly, we've got systems here, the F-22 we're looking at, for instance, other things that ought to be reassessed in terms of whether or not they fit into a 21st century military needs of our nation.
Thank you, Senator. Jennifer, back to you.
Okay, well, thank you very much. Carol Kilminster is with us tonight. Carol, you live in Merrimack, New Hampshire. You're a social worker. Your son is serving in Iraq.
That's correct.
Can you tell us his name?
James.
What is your question for the candidates tonight?
My question is, why is it that veterans cannot receive medical services at the hospital of their choice?
Senator Obama, let's have you answer this question. You serve on the Senate Committee on Veterans Affairs.
Well, first of all, obviously we thank James for his service. And I know that here in New Hampshire, as I've been traveling around, there are some deficiencies in the VA. We don't have a full service VA system here, so a lot of troops that have been injured are having to travel elsewhere. And that's something that I think we have to address. There are important efficiencies that we can obtain by having a VA hospital system. For example, prescription drugs. We've talked about the price gouging that takes place in other systems. In the private healthcare system. The VA actually has done a very good job at negotiating prescription drug prices so that they're lower for VA veterans who are going through their system than they are if they were going through another hospital system. Of course, part of that has to do with the fact that with the Medicare prescription drug bill, for example, the Congress specifically exempted Medicare from being able to negotiate for the cheapest available price, and that was a profound mistake. But just to make sure that you're clear, we have to have a VA that serves everybody, and in some rural communities that don't have access to services that are, the veterans don't have access to the services that are needed, we've got to make sure that they do have the option for a private hospital that is more that is closer by.
So what you're saying is they should be allowed, veterans, not just to have to go to Veterans Affairs hospitals, but go to regular hospitals as well.
I think they should be able to go to, they should be going to VA hospitals unless they have difficulty accessing, and it places a hardship on the family then they should be exempted and be able to go to other
Governor?
hospitals.
Well, I disagree. Under my health care plan, if you have served this country, enlisted, a veteran, I would give you under my health care plan, your husband, a hero's health card, so that your husband could get health care anywhere they want, with any doctor, with any hospital. Our system right now, our VA system, is good, but we have to offer our veterans that choice. Some have to go 150 miles, especially in rural areas. I would also do something else in terms of veterans health care. What we have in our VA system is cost of living increases for other benefits, but not for VA health care. And today, a lot of our vets coming back from Iraq and Afghanistan, PTSD, mental health, we cannot do enough to help them. And it's critically important that we have a well-funded VA system. As president, I would make sure that the VA health system is funded, and we say thanks to those that have served our country.
Thank you, Governor.